We have Sukriti Das coming up. She'll be talking about a very important key subject about the hidden pillar of bipolar care when it comes to family management and caregiver sustainability. Sukriti is driven by a deep sense of purpose to make meaningful choices and take actions that help uplift individuals from difficult moments towards their personal journey and growth, healing, and thriving. She's a licensed clinical psychologist with over 6 years of experience in therapy and counseling, including her training years. She completed her MA in applied psychology, specializing in clinical psychology from Jamia Millia in 2017, along with a postgraduate diploma in guidance and counseling from the same institution. She further completed her MPhil in clinical psychology from University of Calcutta in 2021. She believes that a person is separate from their problems and focuses on helping individuals recognize that their challenges are only one part of their experience rather than their entire identity. Her therapeutic approach is grounded in solution her therapeutic approach is grounded in solution focused brief therapy and cognitive behavioral therapy with a strong inclination toward a trauma informed and client centered framework. She encourages clients to lead their therapeutic journey while supporting them with a structured goal setting at a pace that feels comfortable and sustainable for them. Please have a big round of applause for Sukriti.
Thank you so much. Very good afternoon to everyone present here. I'm actually slightly intimidated to follow my talk after such inspiring, motivating, and simply moving narratives and life stories. But there's so much to learn from their experiences, isn't it? So, today I will take the opportunity to kind of talk about something we know about, something we whisper, something we feel confused in actually positioning care for people with serious mental health conditions, especially bipolar, in a way for people who are standing on the background, right? And that's not something we usually talk about every day. And that's not something we have enough resources out there where access is so easy to get. So let's take a. Okay, they want me on the stage. Wow. Okay, so I hope I'm visible now to everyone. Great. Visibility is important, isn't it? I think that's why we are here to give visibility to the hidden pillar, especially for the families who stand by, for, and of the person who requires the care. Right? One thing that I've always thought about bipolar that how systemic it is. What does that mean? That bipolar disorder is diagnosed in one person, but it is lived by an entire family. Would you guys agree with that? Yeah? Okay. I would love if my call is peppered by your enthusiastic engagement with me. Okay? It doesn't have to be one side where I'm talking and you are just listening to me. It can be you can interact with me. So, yes, whenever we think of any disorder, we feel it is only for the person and their journey that takes a center stage. But that's not true. There are also supporting characters just standing right out on the stage and looking in. Is he okay? Is she need care? Do I need to take care of the medications? What are the finances like? These are thoughts that keep going on. Am I doing enough? Am I is this going to be my life forever? These are thoughts that caregivers go through every day. And these are not just simply thoughts, these are caregiver reality. And what are the realities? I don't think in this room we have any human being who has not experienced this, at least not if once in their life. First is walking on eggshells. Some of the time, caregivers have gone through an experience where they tiptoe around the person they care. I shouldn't say anything. I can't react. If I say no or yes too much, it might make the other person feel very distressed. Is this relatable? Yeah? Okay. You guys can do one thing. If there are caregivers, can I see your raise of hands? If I see caregivers on the room. Oh, wow. We have many caregivers. So I would love the caregivers and the person who is receiving care to participate if any of this situation matches to your reality. Okay? So walking on eggshells, is that something relatable? Yes or no? Yes. Okay. There's this fear of next episode. We know bipolar is peppered by episodes. It's not something that happens on a spectrum or a continuum. It can have moments of stability, but it can also have moments of absolute chaos, which can feel very intimidating for the person who is standing on the edge of a stage and watching it unfold for the person they love, they cherish, and they take care. And there's always a sense of, oh, will this trigger an episode? Is he or she experiencing depression? Why is he talking so much on the phone? Does that mean he's entering a mania phase? Like these are questions that lead to anticipation, which turns into anxiety. You might experience as a caregiver that you're constantly worrying. Like every day your day begins with khana khaya kya nahi, is the person doing better today, am I going to have to take care of other things? So it is never that they're off the clock, they're always on the clock, standing on the bylines checking in. Do I have to worry? Do I have to contact the psychiatrist? Is the medications being taken on time? All of that. There is confusion about mood. Okay, the second, is that common? Yes? No? How many yeses? Okay, all right. Confusion about mood. What is it? Is it depression? Is the person just being rejecting? Is the person not understanding what I am going through? There's a constant check in that keeps happening, which leads to hypervigilance. Where you're checking in on, are you okay? Are you fine? Do you need something? Are you talking too much? Are you all right? Why are you talking so much? Okay, why aren't you talking enough? इन दोनों में ही रहता रहता चलता रहता है, right? This is also true. Hypervigilance, always being on your toes. Right. Responsibility for stability. Caregivers feel it is their duty and their ultimate responsibility. Moment they hear a diagnosis being given, chalo judgment pass ho gaya hai. My partner, my mother, my father, my sibling, my friend, right, is suffering from, let's say, ABC. For today, it is bipolar, right? That means I have to be the custodian to make sure they are good, they are stable. So I have to fix everything. I have to fix my life, I have to fix them, I have to make sure they get the best treatment. If I am not, that means I am not a great caregiver. I'm not a great mother, a father, a partner, a friend, a sister, a brother. All of that, the responsibility to make sure the person is stable and not relapsing or going into another episode is on the caregiver that they carry as a everyday judgment. So, is that true for all? Yeah, I'm not hearing any. Okay. All right. And then there is this. Oh, this is the best friend of caregivers. They walk around just holding the pallu all the time. Hi, I'm guilt. I'll always come up if you spend any time for yourself. Is that true? And they feel exhausted. The exhaustion feels almost that consumes you, but you can't talk about the exhaustion. If you do, but ये तुम्हें तो संभालना ही पड़ेगा ना. Get used to it. You can't complain, you can't crib. The guilt feels like this child who keeps following you for response. Like you're feeding it, but it's still not going away. It's still carrying. And you are like, when will this nightmare end? And it starts to become resentful. You start resenting the life you're leading by being a caregiver. Now, these are not just realities. These are stories of people who have lived countless, I would say, situations where they have wandered in the isolation in their bedrooms, in their living rooms, in when they take a walk in the park. What is my life is coming to? But to understand, bipolar is a systemic illness. Yeah, yeah.
Okay, okay. So I just want to say that, like you said, the caregivers experience emotions like guilt and resentment and others. So I mean, I think the patient themselves, when are in a a relatively stable state, they also themselves then
Absolutely.
tend to sense that the caregiver is going through this, and then it becomes a vicious cycle. They don't want their caregivers to be in that position. So
Absolutely,
that can be
absolutely,
worse.
absolutely. And that, I think we will take questions when I am after the talk. You can find me any corner and you can ask me, correct? But coming to, I have a lot to cover. Okay, thank you, thank you. Can we have a round of applause for his comment, please? Thank you. Now, as I was coming, he said something that even care people who are receiving care, they experience guilt and exhaustion themselves. I want to, that's why I think I'm on this slide, because understanding it is that the individual with bipolar is in the center, right? And everything gets mirrored for this person who is giving the care on the side. So, what the person with bipolar is experiencing is mirrored in the caregiver themselves. So, how do we understand it as a systemic illness? Firstly, an individual with bipolar not only is struggling with the illness themselves, but there are multiple factors which can either make it better or it can worsen the situation for them. And that is why it's a systemic illness, because it gets determined by the environment and the system they belong to. Now, what will make up the system? First thing that it makes up a system would be the decision environment. What is decision environment? Moment somebody gets diagnosed with bipolar or any serious mental condition, there's a lot of decisions to be made. Who do we speak to? Which psychiatrist to see? What medications to take? Do I go to a therapist? Does my person who needs care is getting the right care? Is it the right course of treatment we are going into? There's a lot of questions. There are also questions during crisis, when you are experiencing, when you know that the person you're giving care to is experiencing suicidal thoughts or having self-harming tendencies. What do we do in those crises, right? If somebody is in a mania symptoms, they are having maybe a lot of heightened overactivity. How do we manage it? They're spending recklessly. What do we do? So there's a lot of crisis situations that can come in that the caregiver can feel burdened by, and not only burdened by, but these are, if there is no clear decision environment, how to take those decisions, it can lead to chaos, correct, which can interimly affect the individual with bipolar. And obviously role clarity, who does what. If that is not clear, the mother does this, the father does this, the sister takes care of ABC, so we might have a pandemonium there. So that definitely impacts the person with bipolar. Second is the emotional climate. This is the most talked about situation, like, which is called expressed emotion. Someone who is belonging in a family where there's a lot of criticism, lot of reactions. I think Dr. Sachin just spoke in the beginning that you be non-reactive, be responsive. Why did he mention that? Because it has been proven by multiple research, and there's a lot of studies spanning many decades that tells us whenever there is high level of criticism, dismissal, or stonewalling. So what is stonewalling? When you refuse to interact with the person. What is dismissal? When you say, "Hey, this is not a big deal. Get over it. You're just feeling low. Just go for a walk, you'll feel better." Right? Or when there is excessive level of criticism. ये भी नहीं हो पा रहा है, we are doing so much for you, why aren't you getting better, right? All of that, the emotional climate where they are in impacts the entire system. Then comes daily rhythms. What is daily rhythms? This is where the first sign comes in is sleep patterns, routine, activity levels. Is the family having a routine of their own that the person is able to comply with? Because if the family routine is little here and there, then the person will also get impacted, right? And lastly, communication patterns, which would be blame versus understanding, conflict versus collaboration. If every decision making is fused with conflict, either मेरा बात चलेगा या उनका बात चलेगा, and becomes a fight, then it again impacts the person with bipolar and the caregiver themselves. As I said, they mirror each other. They are not alone. They are in a system. What happens in the system impacts stability. So, stability is not only biological, it is relational and environmental. So, let me ask a question, a very serious question. Okay? When things start to feel unstable in your family, what do you notice everyone beginning to do differently? I can welcome some answers, maybe two or three. If anybody would like to share in response to this question. Yeah? I think there's someone there at the back. We'll try to keep the responses very brief. Okay? Maybe a word we do also do. It's everything. Please give a. There's one. We'll just take two. Okay? Yes. Sir.
Yesterday was my daughter's birthday.
Yes.
We all went to German bakery at Pune.
Yes.
There was a reserved table. Since my daughter didn't get, she got very angry and she came out. Then she booked an auto and said, "We are going home." My wife is diabetic and I am a heart patient. And daughter is bipolar disorder, she's affective. So while going in the auto, I told her, "Beta, getting angry doesn't help. You know, remember Buddha's words. It is like carrying coals on your palm. Your mother is diabetic. If she doesn't eat food now, she will, her sugar level will go down. You have also not eaten properly. We will go to Little Italy. We had our food there, sumptuous meal. All were happy. They went home. I came around 12 o'clock midnight for this bipolar disorder conference.
I hear.
So what I am saying is, as a caregiver, I should have the patience of a mule and a donkey. And your lecture, that earlier slide was brilliant, mutually inclusive, collectively exhaustive.
Yeah.
Thank you so much.
Thank you. Thank you. Wonderful share. He said something so important. Did you see how quickly, because of the situation, he stepped into the role of being the patient listener, to not berate the person who's experiencing those triggers, but help the person kindly understand. So he took on the role immediately to be the patient monk almost, that please, it's okay. We are going to get through this together. So every family does something differently when they are facing those triggers with the person who's experiencing it themselves. I know there's a lot of hand raised. I will not be able to entertain all, but feel free to reach up to me after the talk. But for now, I think I'll take just the person who's sitting in the beginning, at the just front row, just for one more, a very quick take. Can I just have the mic? Try to keep it very brief. Yes. Thank you.
Hi. So my father was diagnosed with bipolar disorder in like 2003. So I was a small kid. I was like 9 years old. So what I did was I began to shut down. I could not go to school and talk to any. I did not understand myself. I was just 9, and I could not talk to my friends or anything. So I started eating my tiffin alone, like in
Ah.
the lunch break, and I stopped eating sometimes, or I used to start going alone. Basically, not because I could not understand what is happening and could not share. And my mother was in the hospital with my dad and all, so she was in that caregiving role. So when things got unstable, basically I shut down. My mom became empathetic caregiver. But yeah, it is like a very difficult phase, I think.
I hear you. Absolutely. A round of applause for her share. Could everybody hear what she said? She was very young. So you have to consider that age because some families do have young members. So this is the reality. So here we are not putting any blame on anyone. We are talking about the experience of how it is for every individual in that system. For that kid, it was too overwhelming. So she went into a shutdown. Every family has their own stories and they are surviving everything with the person who is surviving bipolar in their own ways. Let's take a look at Ravi. Okay, Ravi is a person, obviously names changed for confidentiality, who I have been seeing for a very long time. And he's someone I have worked with uh, who is a 25-year-old, and he was diagnosed with bipolar and he lives with his parents. What all can go right for him? What do you think? When you're a 25, I know. I was I want to first hear your responses if there is any. When you are a 25-year-old and you've just been diagnosed with bipolar, what do you think he can expect from his family that will everything will go right for him? What all can he expect? Okay. And okay.
Non-toxic relationship.
Very good. Okay. Okay. What all can go wrong? In the beginning, we struggled actually. What happened is two things. Parents got very, very worried because they were like, this is like a life sentence for my son. Right? It became incredibly challenging. That led to constant monitoring. बाहर मत जा कितना खर्चा कर रहा है please give us an understanding please take care of your medications always checking on the person so much so there were a lot of restrictions in routines habits what started as a plan became a life sentence for this person now 25-year-old is pretty young you're just starting to discover life in your own terms so agency went and increased fights and verbal spats with the family between the system, it started happening more and more. The parents were left with anger and helplessness, and the person who is experiencing bipolar was feeling incredibly isolated and misunderstood. That made interventions much harder. So, what helped? Now, before we talk about what helps, it's very important to understand some of the common challenges families face. The first channel is denial of illness, where there is members in the family who are unable to accept some members that this is not a reality. The my father, my mother, my daughter, son, sibling, whoever does not have this illness. It may, and which delays treatment, which increases more stigma, and very, this is very hard to say, but it also creates a sense of shame in the person who is struggling. They think that they are causing misery to the people they love, and they're still not being understood, and they still can't get the support they need. So, this is a very significant issue that I think most mental health professionals like us, we sometimes face in our work that we do. Second, high conflict environments. Okay? Now, I want you to understand that denial of illness is not only by the family member. Sometimes the person we are treating might deny it themselves, which is another challenge. So, the combination may be the family is very supportive, they want to help, but the person we are treating is absolutely refusing to accept it. Or it may happen that one member in the family is accepting, another two members or one member are not participating in the same decision making. These all are barriers. These are all difficulties and realities. High conflict environments, this goes without saying. I think frequent arguments, emotional escalations, which increases stress as a system, and it also evokes more relapses in the person who is experiencing the disorder themselves. And this can destabilize mood regulation absolutely. Inconsistent family responses. So, this is what I was saying, when one family member is supportive, another is dismissive. If which creates more confusion and you're not able to move forward treatment. No, I will not let my daughter get treated by that psychiatrist. I don't like him. I don't think he's doing the right thing. The mother would say, no, but I have seen that medication to work. Why? No, he's. So there can be a lot of confusion which make it worse for an experience for as a whole family. There's treatment disagreement. And lastly, role imbalance, where one caregiver may become burdened to take care of everything, and which can lead to burnout, resentment, and more isolation for the caregiver. So, is this a reality that I'm not going to ask you to raise your hands, just a yes or no, that we have experienced? Yeah? Okay. Now, there is some hidden pain of caregivers. Okay? Burnout and emotional fatigue is something we always talk about. But there is pain of isolation and powerlessness. They really feel they have no control over anything. They're doing their best, but it still feels short. There's pain of hyper responsibility, like they have to do everything on their own. Most importantly, is the pain of losing the relationship as it was. Things that were easy is not easy anymore. There's a pain of being invisible in the system. That I think somebody just earlier spoke, that my mother had no say. Correct? So, how do we help? There are four pillars of family management. There's called magic, that is family therapy, and there is caregiver sustainability. So, four pillars of family management is first early signal recognition. Like we teach people with bipolar to learn what are the early signs of any episode. That's something even families need to learn. Second, having a very emotional climate that is regulated. So, reducing criticism, deferring conflict, separating behavior from identity. Look at the behavior not to be the identity of the person. Comment on the behavior, not on the human being behind it. Okay? Healthy communication and alignment. That means noticing something without blaming. I'm noticing that sleep has been hard to get for you in the last 3 days. Can I help? What do you think is happening? Rather than tum time pe nahi sote ho. Very two different. You're saying the same thing. Maybe the care is the same thing you want to communicate. It's how you are saying creates a difference. Rhythm protection, again, consistent sleep wake cycles, regular daily routines, and balanced activity. So, as I said, these would be some of the things that a family does irrespective. Now, what do we do for a family? What does a session in family therapy looks like? So family therapy is a space where the family with the person with bipolar comes to take support. And I don't mean just individual. Individual therapy के बारे में सबको पता है, right? You go and speak to the therapist separately. But family therapy is a situation where the person, it belongs to the person who has the disorder. It belongs to the members who are the primary caregivers, one or more people. It could be mother, father, sibling, daughter, son, whoever, and the therapist, right? So, what happens? First, we map it. So, the therapist will actually take you on a journey together where it will be non judgmental, it will be confidential, and lastly, the therapist would be neutral. They would objectively listen to each participant in the story, not just the person with the illness, right? First, they will try to understand the system. What's happening? What are the triggers in the system, in the person, in different members of the individuals? Okay? Then we are going to clarify different perspectives. Mother might have a different perspective. The person getting the experience of bipolar might have a very different perspective. So we hear everybody out and we try to understand what's happening for every individual. Then we slow down communication. We slow it down. We don't rush through when somebody is describing a difficult moment with somebody in that family. We slow that conversation down and help each of them to listen to each other's sides. Then we do psychoeducation. We teach them together as a family what bipolar looks like and what the support may look like for each one of them. Then we work on real situations. So we take key moments from their day to day life and we solve that through. So a lot of problem solving happens. And lastly, we build a plan. That is the key. So we have a plan. We have a plan who will take decisions when. We have a plan who's going to monitor. We have a plan how the person with bipolar will reach out for support. We have a plan what do we do in crisis situation. So everybody is on the same page. Over time, it has been seen when a family comes for family therapy, it starts off at reactive, emotionally intense. It can be very inconsistent and it can feel like, "Oh, I'm not moving." But over time, you will understand the conditions that's happening within your family becomes more predictable, conflicts have reduced, and you all have gained the tools to work through issues, gain the communication skills that makes managing a serious illness like bipolar easier. Now, how do you maintain caregiver sustainability? Caregiving has to be sustainable because it will be long term. This is not for one day, 1 week, 1 month, 1 year, right? It will be for a long time. Firstly, have a lot of boundaries. Boundaries that may look like I will listen to you and I will take care of you, but I will not be constantly checking on you, right? There could be a lot of understanding. How do we have conflicts? So you make a plan around conflicts. We are not going to do name calling to each other when we are not agreeing. We are not going to bring up past में आपने क्या किया था नहीं किया था in our current conflicts. So you hold boundaries for everything. We create a distribution system of support. One caregiver cannot do so much. You need a village. Like today, it's a village. You have a community, right? So make sure you're not carrying the entire burden yourself. Especially, lastly, have shared responsibilities. And most importantly, have your own spaces, have your own friends, people you can talk to, go for your own therapy, have a place where you can relax. And most importantly, it's very important to understand that care ecosystem, it's like a model. Okay, this model tells us the ultimate goal is to create bipolar care for the person who's in the center, right? For the individual to feel better, they need to develop self awareness and adherence to treatment, right? Are they able to maintain medication? Are they able to maintain therapy? And that how are they able to maintain their routine? That can be possible when they're coming for therapy and talking to their psychiatrist. Beyond that, it is the family. If the family is able to create a supportive environment, that facilitates that person to step one more closer to getting better, feeling more stable. Clinician's role is to maintain treatment and keep monitoring everything that's happening within the system, not just the individual in isolation. And lastly, the community, who is going to be providing support and reducing stigma by developing more awareness. So, this is how care actually works. So, as you can see, it's a system, it can never happen in isolation. So, what matters most? And just at the end, I'll just take one more minute. Okay. Lastly, you don't have to do everything, just do it differently. Stability comes from relationships and not just treatment. That is the most important catalyst in bipolar care. And care becomes sustainable when it is shared and not carried alone. Support doesn't mean control, it means creating conditions where stability is possible. And most importantly, for the caregivers here, there are four kinds of people in the world: people who need a caregiver, people who will become caregivers, and people who will want caregiving, and then people who will keep, uh, what do you say, will keep providing care, right? So at the end, we are all receiving or giving care in some format. It's important you give yourself care so that you can continue giving care. Thank you for the time and the opportunity, Vijay. Thank you so much.
Thank you so much for your expertise over here. This is something that I've always said, that whenever you want to, whenever someone has to maintain a lifestyle with a mental health illness, it takes an entire village to make that impact. And when that is coupled with clinical expertise such as yourself and everything that has been happening at Amaha, that becomes the caregiving much more easier and sustainable, and for them to like move out of the box of that diagnosis. Thank you so much for your talk. What one thing I absolutely loved was the caregiver, the ecosystem model that really resonated with me a lot.
Thank you so much, Sukriti. May I call upon Rajul, please? From one therapist to another. Rajul is from One Talks. Many from the Mumbai Wellness Warriors community know Rajul very well, right? So
Let's keep the applause flowing.